Bill Gradishar, professor of medicine at Northwestern University, where I am also chief of hematology oncology. One of the most common questions that oncologists are asked who evaluate patients with early stage breast cancer are, how do you know the therapies work? Well, obviously, if a patient has early stage disease, one of the elements of their care is going to be surgery. So the surgeon can always tell the patient that I got the tumor, I got the lymph nodes if they were involved, they're gone. The medical oncologist then often talks to the patient about something more abstract, and that is the possibility that there could be tumor cells circulating that we weren't able to detect, and as a result, could put you at risk for a recurrence at some later date. There is no test, no blood test that is commonly or standard of care that should be ordered. There is no standard X-ray or imaging study that is done because they won't detect microscopic disease. So it's a little bit disconcerting when patients hear, well, we're going to recommend this form of chemotherapy or this form of anti-hormone therapy, which you're committed to take for several years. And a common question would be, well, how do you know it's working or it worked? And the frank, true answer is there isn't a test that tells us the answer to that question. Clinical trials over many decades have clearly demonstrated that by receiving adjuvant therapy, meaning post surgery, be it anti-hormone therapy or chemotherapy or targeted therapy in the case of HER2 positive breast cancer, receiving that form of therapy as opposed to not receiving it clearly reduces the risk of developing recurrent disease and dying of breast cancer. But to tell an individual patient that we have a test that can tell us whether the treatment is working is not really founded in any sort of evidence. So the standard approach when we see patients and follow-up, of course, unless they have symptoms, we pursue those with the appropriate imaging. But in the average patient who's doing well that we see 6 months, a year, 2 years, and 4 years later, if they have no symptoms, there aren't tests that are routinely ordered.